Welcome to a brief webinar on 3 critical skills in the Positive Culture Framework. My name is Jay Otto, and I'm a research scientist with the Center for Health and Safety Culture in the Western Transportation Institute at Montana State University. Here at the center, we conduct research on how culture influences health and safety. All of our research is sponsored by organizations and agencies trying to improve health and safety in the communities they serve. This map shows the locations of past and current projects. As you can see, although we are located in Montana, we engage in projects all across the U.S. and Canada. Our projects involve local, state, and federal sponsors. Our projects often involve traffic safety, substance misuse, and violence and child maltreatment. These 3 issues result in tremendous amount of harm in our communities. They're also interrelated. Substance misuse plays a role in traffic safety. Violence experienced as young children will impact individuals throughout their lives, and adverse childhood experiences, or ACEs, are related to substance misuse. We see a lot of commonality between how these issues can be addressed and their opportunities for cross-learning. The purpose of this webinar is to briefly explore 3 areas of skills critical to the Positive Culture Framework. We will explore leadership, communication, and integration skills. There's a lot to these skills. During a brief webinar, we're only able to introduce them. At the center, much of our research focuses on the Positive Culture Framework. In this webinar, we will not be reviewing the Positive Culture Framework. If you have not watched the overview of the Positive Culture Framework, we encourage you to visit our website and watch it before watching this webinar. The Positive Culture Framework provides a way to organize our work. It describes an outcome, in the green arrow, a process, the blue circle with 7 steps, a context, the social ecology in the middle of the circle, and critical skills to be effective. During this webinar, we're going to focus on those skills. So let's begin by focusing on leadership skills. The 3 leadership skills we're going to explore are raising concern and hope, thinking across the social ecology, and cultivating transformation. These are not the only leadership skills critical to being successful. Basic leadership skills are also critical, but in this webinar, we're going to focus on these 3. There are several ways that we can raise concern and hope about the issues we're addressing. First, we need to understand and communicate the harms and consequences associated with risky behaviors. This means we need to be well informed with accurate information. We must share accurate information about concerns without exaggeration or slipping into trying to use fear approaches. Fear can have unintended consequences, including losing public trust. If we lose the trust of those we are trying to serve, we're in big trouble, because then it will not matter what we say. They will not believe us. We also need to commit to growing the positive attitudes and behaviors in the community. This means we need to know what the positive attitudes and behaviors that already exist in the community and constantly champion them. This provides a sense of hope that the solutions are in the community. Without a sense of hope, people can feel powerless and are less likely to become engaged or be willing to try new things. We need to model an appreciative and hopeful attitude throughout our prevention initiatives. Negativity is contagious. It is very easy to start bashing certain groups or agencies or individuals for not doing enough. We need to acknowledge problems and then use an appreciative lens to provide energy to move forward towards solutions. And we must search within the community for solutions to the behaviors being addressed. It can be easy to get stuck in a place of we need more resources, more money, more people, etc. And then we feel powerless. It is true that sometimes we need to advocate for and secure more resources. However, we also need to work with the resources we have and seek to make them more effective. Sometimes this means looking deeply into our communities to inventory what we have and discover what is working. Leading across the social ecology is foundational to a cultural approach. The social ecology offers a way of thinking about community as nested layers of relationships. Leading across the social ecology is about embracing a systems approach to your prevention efforts. You need to understand and educate others that transforming culture is about growing behaviors across the social ecology. It is very easy for us to fall into the individual frame. That is, looking at improving health and safety is just about changing an individual's behavior. But taking a social ecological approach means we intentionally examine each layer of the social ecology and look for best practice. We also need to teach other leaders how to think this way so that they can see how they fit into the puzzle. This is also why it is critical to have good representation of the social ecology in our coalitions. Always seek opportunities to improve organizational, school worksite policies to enhance health and safety. At the school and workplace layers of the social ecology, improvements often include the adoption of policies. Policies are how we codify best practice. While getting schools to deliver evidence-based practices is important, the next step is to codify this practice in policy or educational standards. Thereby, the practice becomes a part of the school's culture. At the community level, we need to advocate for strong laws and enforcement to protect community members. Laws are a way to codify the norms of the community and provide a mechanism whereby we can teach youth and those people entering our community what is important. Laws don't have to be about punishing people. Laws are a way to communicate. Cultivating transformation is critical if we're going to make long-term lasting change. Remember, we can only transform ourselves, but we can create the conditions whereby others are more likely to be transformed. This is called cultivating transformation. We can cultivate conditions in which long-term transformation is likely by quieting the voices of judgment, cynicism, and fear within ourselves and others. This creates a safe space for people to learn new ways of thinking. We have to create enough goodwill and trust among our coalition members that allows them to start challenging core assumptions and allow new ways of thinking to emerge. We need to seek to change systems rather than implementing individual programs. Sometimes in prevention we become program pushers, just trying to push one more program in various contexts. However, we need to expand our thinking and really focus on systems and how they interact. And we need to focus on sustainability rather than short-term solutions to complex issues. Thinking about sustainability from the beginning is critical. Even as we explore possible ideas, we need to ask how the ideas would be sustained. This will lead us into focusing on changing existing systems first before adding new programs or strategies. We need to think long term. That was a very fast overview of just a few leadership skills. Developing those skills takes time, practice, and dedication. Our intent in this webinar is just to introduce them to you. Now let's shift and focus on communication skills. We cannot imagine improving health and safety without communicating. Communication is central to all of our efforts, so being effective at communication is very important. We're going to look at just 3 communication skills. Clearly there are more, including having good written and oral communication skills, as well as nonverbal skills. First, we want to design communication to close gaps. Now, we define a gap as something that people do not know, a gap in their understanding. This could include not knowing that a certain behavior is risky or not knowing how to prevent a behavior. Around any issue, there are typically many gaps. However, it's busy or a waste of time to tell someone things they already know. So we want to make sure that we understand what people's gaps are before we create messages. We are often surprised about how many efforts tell people something they already know, which is just being busy and not being effective. Next, use communication as a catalyst for other prevention strategies. If a communication campaign is your only strategy to improve health and safety or to grow a positive culture, you're in trouble. Communication campaigns are very difficult to do, cost a lot of money to be effective, and require a lot of time. Instead, it is valuable to think of your communication efforts as a catalyst for other strategies. The communication can give energy and create shared understanding that can foster adoption and engagement with your other strategies. This is what we mean by being a catalyst. And finally, but very importantly, we want to tell a new story in our communities. A new story about the goodness, the health and safety in our communities. Too often, the stories that are being told are about what is wrong with our communities. But we need to talk about what is good and healthy as a way to shine a light on this goodness and to grow it. For thousands of years, we have conveyed our culture through storytelling. We continue to do that today. We're just using new technologies to do it. If you're going to engage in a campaign in your community to improve health and safety, you should go in with eyes wide open. This is difficult work. The research is clear that effective campaigns should achieve adequate dosage and be implemented with other efforts. Successful campaigns should be theory-based, not based on what people think would be an effective message. Often media firms will use focus groups to try and figure out what message will work. Sometimes this works, and many times it does not. Having a strong theoretical foundation is a lot more than just asking people, what do you think would work? It is also important to assess exposure and other process measures about dosage. Hands down, a leading reason campaigns can fail is that they do not have enough dosage. Mass communication requires a lot of repetition and a lot of messaging, and that usually equates to a lot of money. At the center, we strongly encourage you to engage in a structured process to do a communication campaign. This is the process we use. We don't have enough time to go through this process during this webinar, but there are other webinars on our website and training we can provide on this process. You can visit our website to learn more. There is a lot to developing effective communication skills. Again, our intent in this webinar is just to introduce these ideas. Now let's shift and focus on integration skills. Integration is about making things whole. That is, aligned, coordinated, synergistic. Integration skills are more complex and take time, although as you will see, there are many things we can do to foster integration immediately. We're going to focus on 3 broad skills: creating a coalition with an effective culture, the need to augment and refine programs and strategies, and the importance of seeking alignment across and between systems. So let's begin by focusing on a coalition with an effective culture. Sometimes spending the time and energy to build an effective coalition seems tedious and not as urgent as jumping in to address the problem immediately. However, if we're going to really work across the social ecology and take a systems perspective, and if we're going to sustain our efforts, we need to recognize that coalitions are the key agents of community and organizational change. Research has shown that even in organizations like for-profit businesses, when culture change efforts are led by powerful leaders, they tend to disappear when the leader leaves. Sustained efforts, even in organizations, are best done by coalitions. This means that coalition building is worth it, even though it takes time and investment. One important way to build a strong coalition is to invest in common purpose and shared values. While it may seem obvious why people engage in a coalition, it is always valuable to spend the time to explicitly clarify your purpose and shared values. In times of conflict, and you will have conflict, you can rest into your shared purpose and values to hold the group together. Another key step is to invest in common language, understanding, and measures. All too often, we find coalitions that are trying to work together but are speaking different languages and do not have a common understanding of the problem. This leads people to argue or not engage. Of course, because either they do not understand what is being proposed or they see things very differently. It is important to address this early before attempting to do strategic or action planning. Here is a very simple process to help grow an effective culture within your coalition. Remember, your coalition is a group of people, and therefore it has a set of shared values, beliefs, and behaviors. In other words, a coalition has a culture, and its members create that culture, either very intentionally or just by letting it happen. We encourage you to be very intentional. Begin in shared dialogue about what your purpose is, why you are here. Write it down. Put it at the top of every agenda and revisit it often. Next, develop shared understanding by engaging in shared experiences. This will grow shared beliefs. Shared experiences could be engaging in training together, reading and discussing a report, or sharing local information. Remember, just because everyone read the same report does not mean that they have the same understanding. You have to discuss it. And then engage in shared actions by co-creating plans. Co-creating plans is more difficult than just having one person or a consultant develop the plans. But co-creation fosters more ownership and buy-in and will result in more people engaged in the work. The second integration skill is about augmenting and refining programs and strategies. As we have discussed in other webinars and in our trainings, there's no single strategy or program that will address the complex issues we are facing. We have to engage in multiple strategies and programs at multiple levels of the social ecology in our communities. We need to be proactive and manage the complexity of diverse strategies. Therefore, we need to actively manage our portfolio. We call the collection of programs and strategies a portfolio. We very intentionally use the word portfolio because that brings to mind the idea of an investment portfolio, like what we might invest our retirement in. Thinking of the collection of programs and strategies like an investment portfolio is important because, like an investment portfolio, we invest time, money, and resources in our programs and strategies, and we want a return on that investment, an improvement in health and safety. There are many skills involved in managing a portfolio of programs and strategies. The first step is to map our existing portfolio. In every community, there are already many programs and strategies in place to address the issues we're working on. We like to map the existing portfolio using two dimensions, the continuum of care and the social ecology. When we use these two dimensions, we get a very clear picture of where our investments lie. Sometimes we can be overly invested in one area, like universal individual programs. And sometimes we can be underinvested in other areas, like selective programs for families. By mapping our portfolio on these two dimensions, we can develop a better shared understanding amongst our stakeholders of our existing resources. The last integration skill we want to mention is about seeking alignment across and between systems. The complex issues we face involve many systems, like schools, local governments, state governments, law enforcement, healthcare providers. All of these systems have rules and procedures that guide their efforts. Sometimes these rules and procedures align and support integration at the community level. Sometimes they don't. Sometimes the rules and procedures get in the way of the very people the agencies are seeking to serve. Ways to seek alignment across and between systems often involves asking complex, difficult questions. Questions that can really only be honestly answered in an environment of trust and with an intention of improving outcomes. Sometimes these questions are asked of the agencies. Sometimes these questions are asked of those being served. We don't have time to go into these questions here, but such questions are available in our training materials. Improving health and safety is hard, especially for the complex issues we're facing. The easy issues in public health have been addressed. The issues that are remaining are difficult. Therefore, we need a framework to organize our efforts, and we need skills to be successful. Our intention during this webinar was just to introduce some of these skills. To learn more about our approach, visit our website. We have other webinars on similar topics. You can also learn more about when and where our next Positive Culture Framework training will be. Here are some questions to help process your learning. How can you improve your skills in raising hope and concern, leading across the social ecology, and cultivating transformation? What can you do immediately to make your voice a powerful communication tool to close gaps about your issue? How can your coalition work on building a more effective culture, augmenting and refining programs and strategies, and seeking alignment across and between systems? How can you start to shift the coalition from one that engages in a series of single events to one that invests in evidence-based strategies that may take longer to change behavior? Please feel free to visit our website and follow us on Facebook and Twitter. Thank you for your time.